What's up, everyone? And thank you so much for tuning in to a new episode of Lattes with Lindsay. I am so honored to have my next guest on. Her name is Joelle. She is actually out of the country, and I'll let her explain it to you. But she's going to educate us on physiotherapy and really what it's all about. So without further ado, how you doing, Joelle?
Hi, Lindsay. Oh, I love the name of the podcast. That's awesome. Thanks for having me today. This is awesome. Thank you.
Of course. Well, I know you got your coffee ready. I got my turmeric tea, so we are ready
Mhm.
for action.
We
So why
are.
don't you tell us a little bit about yourself? Who is Joelle? Who is this lady?
Well, that's me. I'm Joelle. Joelle Coran. So yeah, I'm a physio. I've been a physiotherapist since I graduated in 2009. So just over 10 years. Working in Toronto for most of that. Graduated from University of Toronto for my physio. And yeah, I've been working in private practice, orthopedic, sport kind of stuff since then. Um, and I guess more recently, I've moved, well, say the last couple years, I've been back and forth between Australia and here. Um, and we'll call it a bit of a, I don't know, calling. Like that's sort of what brought me here in the first place. And I kind of discovered that Australia is similar to Canada in a way. I got the same feelings, but I didn't have to experience winter. I'm a bit of a sun baby beach bum kind of person. And yeah, when I found Australia, I'm like, this is where I want to be now. So the last 2 years I've been back and forth working here and in Canada. And then I've officially made the move to the south coast of New South Wales in October of
Woohoo!
2019. Yes. Yeah. So, and I've been here working in a mix of different stuff as I sort of get organized and sorted in this crazy year that we've had.
Oh my God, 2020 is definitely off to an interesting start, that's for sure. But for the viewers who haven't been to Australia, what is it like there? Like, what is the vibe there? Is it, super friendly like Canada, or is it very clicky? What's it like there?
Yeah. So, I mean, I'm because I'm in the like a coastal town, I feel like I have maybe the small town experience more than the city experience. I came from a big city and kind of like Toronto, and I feel like Sydney reminded me in a way of Toronto. So just that big city vibes, busy, hustle, bustle, that kind of thing. So just kind of similar. And then coming down to the South Coast, I feel like has been pretty similar to a more smaller town feel in Canada. So everyone's saying hi, like you say hi to your neighbors when you're walking down the street. Even more so now that dog, so I'm walking a dog, I know all my neighbors. um, and yeah, like it's generally pretty friendly. Like people have the time to chat and get to know you and want to get to know you. I found like a little yoga community here that I absolutely love, so I think that's helped a lot. Yeah. So yeah, it's been magical. Like there's this cute little yoga studio that I'm working out of now. So I'm setting myself up there as a practitioner within the studio. But yeah, I think that community has really helped bridge the gap for a lot of people, or like allow a lot of people in the community to meet, because I think small towns too can be cliquey. I think like you have your friends if you've grown up, if you've grown up there, then you've like your friends, you've got them, and that's kind of it, and you don't really branch out. But in a space like a yoga studio or a fitness kind of environment, you bond over just similarities, right? So I've gotten to chat with quite a few people and developed some really good friendships pretty quickly just by doing that. So that's been really nice.
Aw, that is nice. It's so important.
Yeah, I would equate where I am. So it's called Malua Bay near Bateman's Bay in New South Wales. So it's about a 4-hour drive south of Sydney. I'd equate that to cottage country. So it's sort of like the beach houses, that kind of thing, similar to
Oh,
cottage
okay.
country in
Oh,
Ontario. So yeah, I feel like I'm on the way to living my best life.
I know Mary and I would love to be out there with you. That's for sure. We would love to road trip out there because it's definitely a place where a lot of people have wanted to go, you know what I mean? And it's halfway across the world and it's exciting and it's, beachy and adventurous and it's a good environment. I agree with your choice. That's for sure.
Well, I can't wait for you guys to come visit so I can show you around.
My gosh, I know. And if Mary's listening, let's go, girl. I'm
Yeah.
ready. Yeah, so why don't you tell us a little bit about physiotherapy? Why did you get into it? What really it is and what are some of the benefits?
Yeah, so physio for me actually was something I decided in university. Like it was a bit later. I went to university knowing I wanted to be in healthcare of like some sort, wanted to help people. Um, I liked science. That's just what I got attracted to. So yeah, I had some experience in a couple of physio clinics for injuries as well as just to try volunteer experiences kind of thing. And yeah, loved it. I think what I loved the most and what kind of geared me towards pursuing it was that like you had could work like pretty closely with your patients. You had time with them if you gave the time to work with them and develop um, meaningful goals and help people achieve those meaningful goals, like things that they wanted to get back to. I always appreciated movement. I love exercise. I really believe in the power of movement and like its healing powers, say. And yeah, and so I think watching that and seeing how rewarding it can be on both ends as a patient and as a practitioner, I was like, yeah, I want to pursue this. And some of the physios that I have met actually, to me, like seemed like the smartest people ever. Like they just knew stuff. They just knew the body. They could explain certain things, and it was as if they were seeing the body on the inside, but in real time, kind of thing. And I was like, yeah, I want to be able to do that. So yeah, so I pursued it in that sense. Yeah, and as it sort of developed, I guess, so 10 plus years now of working, my interest went towards private practice. There's many different fields in physio school. We learn about various types of physio, but like we can work in the hospital, we can work with all sorts of different populations, from like spinal cord, head injuries, uh, post surgical, um, and then yeah, sports injuries and repetitive strain kind of injuries as your day to day, which is sort of what I've kind of geared towards is the the everyday athlete. So just our weekend warriors and gym goers and all of that stuff. And yeah, and so I've in specializing with that, like I've kind of taken to some of those really challenging cases. I love working with people who, have had these chronic issues that have been going on forever. And, I want to try to figure that out and put the pieces of the puzzle together and get them moving freely and pain free. And yeah, all of that.
All
So
that jazz.
all that jazz. So it's like, yeah, it's a big thing. It's a big thing. I guess the main thing with physio is when we do graduate, it is still like we have a big world. Like we have, many physios can pick different pathways. And yeah, it's just what you choose to specialize in, there's physios doing pelvic health, pelvic floor physio now, which is wonderful. And I really feel like everyone needs to have their pelvic health physio,
Hmm.
because it is sort of that silent thing that hasn't been talked about for a very long time, but has such a big influence on the whole system, right? The whole body. Um, I I've trained a little bit with a physio who teaches. She's from the States. Her name is Julie Wiebe, and so I do a little bit of pelvic floor core training, but external. So I don't do any of the internal stuff, but I'll help women get back into exercise and activity and that kind of thing, post pregnancy, and even like and during pregnancy with that kind of stuff. Yeah, so the nice thing about my work, I would say, is that every day can be something different, which is so fun. Like it makes it so fun, because every day can be a new challenge. Um, in like we can say that typically, uh, certain conditions we can find certain dysfunction for, in a way, right? Like, so there can be a bit of a pattern, but the driving force for the most part will be different for everyone. But that's sort of the beauty behind it. Like if we're going to go pelvic floor specifically, say, dysfunction in that area, in and around, say, the deep core, um, can show up as back pain, can show up as deep hip pain, can show up as knee pain, can show up as shoulder pain, or shoulder, and I say pain because that's often what brings people through the door, but it's dysfunction. Like there's some sort of imbalance or something going on that's due to insufficient functioning, or inhibition at another level, right? So and with pelvic floor too, like it can even show up as like neck and jaw pain, so or dysfunction, that kind of thing. So it's so important, really, to look at the whole body and not go into a session and just, if you see a and then just expect a certain blueprint kind of pattern, right? So like, yeah, like I could say there's probably some typical things that I might find, but or that I might say try to explore or look for, but every patient is a blank canvas.
Yeah, and I love that because everyone is their own person. So, I find that all of our guests have had conversations about how assessment is vital because just because they just got a doctor's note and said it's low back pain, you're very much correct. Like it could be a referral from somewhere else, or they didn't assess above or below. So, yeah, definitely the first assessment is
Mhm.
always crucial. Absolutely.
Yeah. And so, like, for example, with that back pain, which I think is really important, is always ask about the ankles. So, the foot and the ankles, injuries like that, like, haunt us for ages, and we don't even know. And it can show up as back pain, months or years down the track because we've been compensating for this old injury that maybe never really got properly rehabbed. And we know that in the athletic world, people are working on, like, playing on injuries all the time. That's how it works. It
Yes.
kind of has to be that way. And our role is to maximize the efficiency of the body we're working with for their sport, knowing that there's this dysfunction, maybe some dysfunction underlying. But that's also really cool because it's just like, I don't know, usually we have a lot more access. Like I can't say that all the time, obviously, but like with many athletes, we do have a lot of access to them. They are around, they're ready, willing, and able to participate in their rehab. Which, like the regular patient, we might see them once or twice a week. We don't maybe see as many of the gains, or like bounce backs, like as we would with athletes, because they're pushing their bodies. We're going to help them a little bit. We see them improve really well, and then they push their bodies some more, bounce back, help them. So there's this like sort of fun little play that, they're having their fun, we're having ours as the therapist. Um, and it's a bit of a slower progression usually with um, the rest of the population, because we won't necessarily see them as regularly. What they're pushing their bodies to do is not as intense, obviously, with, if it's like an office work kind of thing, or they might be doing like their sport once a week, um, or exercise, like, gym 3 times a week, that kind of thing. So it's, but regardless, like it's just all still, yeah, like fun to work with, kind of thing.
Yeah. Well, it's hard because I think with the general public, more so like the remedial exercise that we give them is for home care, and they have to do it on their own and initiate it and all that kind of stuff because you and I can only go so far with, we assess this, we tell you what's going on or what we think is going on. These are our suggestions, and then you can take it or leave it. And I find when you work with athletes, because you're so individualized with them, that when you go and watch them play a game, you treat them before or after the game or whichever, and you can see them improve, or you find something new, which for us nerds, that's like amazing, but like obviously not the greatest for them, but we get excited. So,
Yeah.
like there's a little bit of give with different, assessments that you have to do with the general public versus the athlete. So with your assessments, for
Mhm.
I guess both, how do you find it? Like, do you always do like an hour? How does it go for you?
Yeah. So my assessments, um, have changed through the years. Definitely from what I used to do as a new grad to now, it's obviously changed a lot. I attribute a lot of it to my like education and participation in the neurofunctional like contemporary acupuncture program at McMaster. That I've taken and then gone and taught or helped teach in over the years. So I have to give Mad like so much credit to that. The teacher there is Dr. Alejandro Iloriaga Claraco. And Alex, as we call him, as we call him. But yeah, like so much credit to him, and then many of the instructors there that have sort of shaped the clinician I am today. But yes, so one of the main things that I took away for like assessment specifically is like every session is an assessment, right? So every single one. The first one obviously being one of the most important ones, but that's when you start, that's when you get introduced to your patient and start to get to know them. But every single one, every single time you see them is an assessment, and like a minimum 1 hour is ideal and like needed. I really like looking back, and I know whenever I've been limited to less than that, I feel like it's never as thorough. And I definitely then need to go back and do some more specific assessment the next time I see them, or maybe have them come in sooner so that I can kind of fill in the gaps with that. But yeah, minimum an hour, and I'm looking at the whole system. So it's not, again, I'm not really honing in on just say the one complaint that they had. I'm gonna look top down. I'm gonna have them do maybe some general functional exercises, movements for me to see how their body moves on the whole. Maybe, and then some specific ones pertaining to the area of dysfunction, right? So if it's a shoulder and they feel it only when they do push-ups, I'll get to the point where I'm going to have them do push-ups for me as well, just so that I can see. But I'm also looking at their squat. I'm also looking at even just how they're walking. Um, because all that whole top down, bottom up approach, like your feet affect the whole body, right? And your shoulders,
Yes.
body affect all the way down. So yeah, so we'll work into that, and then take a more a closer look on the table. So have them, well, I'll move them and I'll palpate and I'll feel for connective tissue tension, feel for the nerve tension, see what reproduces their pain, that kind of thing. And then will treat. So every assessment also has treatment so that I can see if if any of my sort of hypotheses are heading in the right direction, right? So
Yeah.
yeah, so minimum an
Which is a
hour.
huge question. Yeah,
Yeah,
it's always a huge question when you go into those first initial assessments, because it's like, am I going to get treatment at the end of the day? Is it going to work or whatever? It's always the first question. And to go back to what you said earlier, if you are getting low back pain, it could be coming from your feet, it could stem from your knees, it could be from anywhere. So when you give a health history to a healthcare provider, it is essential that you put all of your history on there, because I have, and I'm sure you have too, you get someone on the table and 15 minutes in, they're like, oh yeah, I actually did strain my calf about 2 years ago, but I didn't think anything of it, or whatever it is. And it's just like, oh
yeah,
no, and that makes
yeah,
sense why other things trigger. So knowing
yeah,
everything from their health history, that's why the assessment is so vital. And 100% I agree with you. So
yeah.
working with with athletes, what is it like for you? Like, what is it that you enjoy about working with them?
Uh, um, yeah, so much. Um, yeah, like
Everything.
they're
Yeah.
yeah, everything. I don't know. Like it's athletes are fun. The environment is fun. I love being part of the team, like their health team. Um, I just love being a part of it. I think my experience to date really is like when I've been part of a health team, like I just feel like I'm constantly learning from everyone else who's also helping that athlete. So, um, like I'm not the pro. I'm not in that team environment where like, but I've always loved being part of a team. Right? I did grow up playing sports, and I think one of the I guess most rewarding things is being able to have this athlete that I'm working with and then bounce ideas off the rest of the members of the team so that we can work together and get this guy or girl like out there doing what they love as best as they possibly can.
Yep.
And the
Yep.
accessibility of that when working in that environment is so much easier than in clinic, right? So we're often it's so hard to like sit down with a colleague and try to bounce ideas off patients, especially if we're not sharing the patient, right? So it's just like, this is the scenario, any ideas? Whereas here, like, we're sharing the patient, we're all working, we all have our own little specialties, and we can all fit the pieces of the puzzle together and efficiently, which I love. Like that sort
Yes.
of, that's part of the whole, like, you can see things happen so quickly in that environment that wouldn't necessarily happen in like general practice kind of thing. So
Yeah.
that would probably be my best. And then, they're fun. They're always fun. I find that just good
They
banter.
always have, honestly, the craziest stories. Honest to God. Like, it's like sometimes, like the thing that I agree 100% with you about is the teamwork. It's, you're all in the same kind of room. Like, I mean, we worked at Paragenics, like, we're all kind of in the same little locker room and,
Yeah.
we would bounce ideas off each other. And I agree. It's so much easier than, being behind a closed door, treating, and then having to go out and meet with another practitioner, but your hours may be completely different or whatever it is. So it's working with athletes, sometimes you're in the same arena or tennis court or field or wherever it is, and to bounce off ideas and you do this, I do this, or even just learning new techniques. I think that's the most wicked thing. And I told Mary this too, is I'm just so grateful for that experience with the camps, because I was able to meet you, I was able to meet Mary, I got to work with Matt Nickel, and I think it's just really special because all those relationships have educated me so much more on professions too. So it's
Mhm.
a wicked kind of yin to the yang of jobs. So I agree.
Yeah. I feel like I learned a lot in that experience as well, which has been so great. Yeah.
I know. It was an experience. That was a wicked experience. It was busy, it was fast, like to meet some, obviously
Mhm.
professional athletes and all that kind of stuff was truly an honor, but even just, knowing them not on the ice is also special, and you get to know who they are, their families, their kids, their engagements. God, we found out so many engagements. So it's exciting to build that rapport with your athletes and see where that goes. So I agree. I agree.
Like they do become just your patient in a way. And I don't say just your patient, but it's sort of what I mean by that is it kind of carries over to how you would just sort of treat in practice too. Like every single patient is your athlete in a way, right? Because they all do have their own goals. And that's what you're trying to achieve. Those goals are just at different levels. And it's kind of, I think the nice and fun challenge as a practitioner is to meet those goals and work with each patient, no matter what their level of athlete is, in quotations, right? Um, that makes it like so interesting and rewarding and kind of always a challenge, and why it makes every single day of practice so different, right? Like,
Yeah.
it just keeps you engaged.
Yeah.
Keeps me engaged, anyways. But I'm a dork, so.
Yeah. I am too, man. I love taking courses and learning about how to be more dorkish. I swear to God, it's awesome.
Yeah.
But I agree though. Like I don't think, for me, a person is a person. And I think everyone has different skill sets. And I know that all humans are great. So,
Mhm.
to work with all levels of athletes is exciting. Whether it is Pee Wee, NHL, CWHL, whichever it is, it's exciting because even when you mix different sports, then it becomes even more of a challenge because it's a whole different like gate everything and assessments and all that stuff. So I feel like it almost helps you gain more knowledge with your assessments if you were to treat the general
Yeah.
public because you're so much faster because you don't have that
Yeah.
much time
Totally. Yeah.
ever.
Lots of carryover too, right? Knowledge in that sense.
Yeah.
And you do have to think differently with each sport. And what you do with a hockey player is not what a tennis player is going to need or what a basketball player is going to need. So it's like, yeah, it's just going to always keep your brain going, which is so fun.
Yes. Yes, exactly. I know, and I have this I found this iTunes gift card that I've had and I downloaded this app where you can look at the muscles in like 3D and then now like I just did the update and now it's like 4D and I'm like,
Ooh,
"Okay, this is amazing." Like I'm like you can 360 the
which app?
muscles
Which
and
app is that
show
one?
people where they attach. I'm gonna have to look at the name.
Oh,
I
you get it to me
will.
later. That's okay.
I'll send it to you. I'll send it to you after.
Yeah.
But it's really wicked. It just educates people on how to know more about themselves. So with all the experience that you've gained within those many years of working, which is amazing, a success in itself. What has been one of the greatest accomplishments thus far in your career?
Oh, that's a big question.
I know, right? I always love asking this because I think it's so good to show people success because everyone does have success if it's small or big or
Yeah.
whatever. So
Yeah. Well, I think I have a few successes in different realms of my profession, I'd say. Like I felt like one of my biggest achievements that was a goal of mine when even just in physio school and graduating was to be able to work with professional athletes. That's what I wanted to do. I remember thinking I want to be the physio for the Toronto Maple Leafs. Like that was like one of the things that I had sort of said. And while I didn't do that per se, I ended up in you know, an arena off-season training camp working with professional hockey players. So like that was a massive success, and I was so happy to be able to have that experience, and that is through the connections I've made and my mentors and working hard, like really just kind of showing up and being there and um that kind of thing. So like that was huge, and I felt, yeah, pretty lucky to kind of get into that world, which was really nice for many reasons now. So I would call that a success for sure. One of the things looking back on my career that prompted this latest project that I call it, like, a friend of mine and I are doing is like, is this sort of success with mentorship. So one of the things, like, I guess throughout my career, take a lot of courses, meet a whole bunch of people, and then how do I put that all together, right? And I didn't really have that one mentor that I could go to and like sort of help kind of shape that. I had a few, and I think that helped shape me. But one, like, what's kind of come of that is a mentorship program that my friend Julia Setnar, physio in Toronto, and I have created to help healthcare professionals, new grad physios, that kind of thing, navigate the real world in physio, from graduation onwards. And so we've been doing that for a couple of years, and it's just been, the sort of COVID, that kind of thing, has allowed us to spend even more time developing it. And that's been a huge success in our eyes. And it's still in a work in progress, but I don't know, I need to celebrate that success because it's been, it is a lot of work, um, and but meaningful and rewarding work as well, and to have our community grow, and yeah, it's been amazing. So that's been a really good one as well. So
Well deserved. That's holy smokes. That's amazing. I didn't even know you did that. That's a fun fact, that's for sure. Wow.
yeah,
And do you guys, yeah,
yeah,
what do you guys call it?
yeah. It's called Physio Mentors. We're not overly creative, but it's to the point. And yeah, like we partnered with Athletes Care to help mentor new grads that they hired, and but we are also sort of branching out in general. So, we also mentor graduates or students of the neurofunctional acupuncture program, like the contemporary acupuncture program at McMaster.
Hmm.
So we, had tutorials running for that, and we mentor them as well. And yeah, it's just a environment or a community that we created to help people who want mentors and who want to hone in on some of these skills, particularly like in the neurofunctional world, in this sort of uh, yeah, that holistic approach to assessment and treatment and that kind of thing. So yeah, that's
Wow. Wow.
been really good.
That's special. Okay, you got to give it a shout out then so people can follow it. What's the
Physio mentor, yeah.
Physio Mentors? I
Yeah.
love it. I love it. Oh, at least it's easy to find.
Yeah.
That's for sure.
Yes, exactly.
So, with being a
Yeah.
mentor and, helping, because that's honestly that's the biggest thing that I love about all my guests so far is that each and every one of them are wanting to give back to their school or give back to, their education or where they came from because you know, we need help
Mhm.
as students, and for people to take the time to mentor or help us with
Yeah.
courses or needling or whichever, I think that's vital because that's how we really improve our professions, right? So through the years of you working, have you seen many improvements or changes with your profession?
I think is always changing. There's lots of research, tons of research. I think one of the other things with, I guess, our recent pandemic is like I've had a fair bit of time to look at a lot of the online courses and conferences that are out there. And actually, before this, I had just recently gone to a sports medicine conference in Australia as well. And it's really just like nice to see all of the inquiries that are happening. Like, yeah, I think you're always changing and developing as we learn more about the body, pain science. I think that's probably the main thing that I've noticed as the general theme of what I've been at least watching is this increased focus and understanding or attempt to understand pain science, the pain paradigm, like because it is hard to understand. Everyone's pain is experienced differently. How do we really research that, and how do we then begin to apply it when every person we see is that blank slate that this technique may work to help with their pain, but it may totally flare up somebody else, that kind of thing. um, but I think there is shifts into that and understanding, at least in the physio world, that the physical stuff isn't the only thing that we should be doing for pain, right? It is multifactorial. It is mind, body, everything. And even if we don't feel that we're comfortable addressing some of the stuff
Yes.
outside of the physical, to accept that there are these other elements, and to then create your team of referrals, that kind of thing, the people that you need to know to help your client the most, I think is really good. Like, I think that's sort of what's come of, for me anyways, of the latest knowledge that I've been sort of looking at. But we started physio started in hospitals, maybe walking people, ultrasound, tens, that kind of stuff. And I see the huge shift. Like, we don't do that very much anymore. Like, I have not touched an ultrasound machine in ages, except for like biofeedback kind of stuff, which I core biofeedback stuff. So, but not to treat, and um, yeah, like I think we've shifted along a far way from like sort of some of these modalities to really functional, holistic, multimodal approaches.
Yeah. Yeah, exactly. And that's exactly what it is. I mean, you go back to the team environment in itself. If you know that you can fix this portion, but there's still, three pieces of the pie that still need to be fixed. If you have those great connections, and plus the client also really appreciates you doing that and going above and beyond and saying, "Hey, I know I can fix this, but these three are just unobtainable. But these are the people that I would strongly refer you to." And, it's great because that also brings more people into your clinic, which I mean is always great for us, but it's always beneficial because you also know that that rapport is the perfect balance with that client. And then, the more clients that you get, the more experience you get with that, and you'll get better at it. But I think that's great that you do divide and use your resources effectively because you need to. That's what our job is, right?
You can't do everything, and it doesn't serve you or your patient to try to do everything. Be good at your thing, whatever that is, be great at it, be the best you can be at it, and then find those people who are the best at their thing and work together. So,
Yes, exactly. And how did you start building those connections per se? Like how did you, for someone who is just coming out of school and they need an explosion of resources, how did you connect with different people? Where did you start with that?
yeah, it started within like my first clinic, really. Like I met, you speak to your colleagues in whatever clinic you end up at for the first, like your first job kind of thing, and you start to get to know them, right? Like some will resonate with you. There's still some massage therapists that I refer to from the first clinic I ever worked at, that I remember, and like because I've been their patient so that I can feel what they do. I've talked about other patients with them that we've shared or haven't shared but are clinic patients, that kind of thing. So, speak to my colleagues. The courses that I take, some of them, weren't just physio specific, like the acupuncture program. You meet, doctors, naturopaths, osteopaths, massage therapists, that kind of thing. You meet all of those people, right? So I've had uh, like great opportunities to meet all sorts of clinicians from that, and many of whom are my team today, like that I've referred to. Um, uh, yeah, I think and then like events, like working at different events, volunteering, sporting events, that kind of thing. You meet coaches, you meet other like athletic therapists and that kind of thing that work with the team or work with another team. It's just about getting like putting yourself out there and talking to people, right? One of the other things I did early on, like there was a gym really close by to the clinic that I was working at. So, I mean, I go to the gym anyways, but I started talking to the personal trainers and just seeing what they were like, so that now if I have patients that, can't are ready to go to the gym, I can, refer to this person because I trust them and I know, what they do, and I have an experience with them. So, and the more people you meet like that, then the more diverse your team can get, right? And so those trainers would refer patients to me when, one of their clients happened to do too much or injure themselves or whatever. So again, this reciprocal symbiotic relationship with your entire community, more or less.
Yeah.
Yeah, you just have to put yourself out there early on while you've got like all the energy to do it too, and then
It's true. You're like eager beavers at the beginning.
yeah, and then
So
and I've
true.
actually had like one of the first naturopaths that I still refer to today was a patient of mine first, and we got talking and that kind of thing, and it was just sort of a fluke kind of thing, and then
Yeah.
yeah, so all of that happened.
But that's the greatest part. Like you can meet anyone who can benefit your future literally anywhere. Like I had the chance to go to the Pan Am Games, and even though it's a volunteer thing and whatever, it was amazing because I met doctors and naturopaths and chiros and even the massage therapists that I still keep in contact to this day. And I agree, it's a vital thing is just be your bubbly self or try to and meet some new people. But it's important. So did you find when you first started your career, like did you do a lot of volunteering with sports to kind of get into it? Or did you work with teams or anything like that?
Yeah, tons of volunteering. Was what skate Canada early on, rugby early on, and that was again just through either like physios, like some of my colleagues, like some of the physios I went to school with who got into it. You know, if they sent messages out like, "Oh, we need help, we need more physios." Great. Like I kind of just signed up for anything and everything just to gain as much exposure as I could. Like yeah, like figure skating, the rugby, hockey. Hockey was the main one where like, I had a team that I was like kind of a part of and traveled with and that kind of thing in and around the area. Um, yeah, track at U of T, that kind of thing. Yeah, just what any opportunities that sort of, the emails come when you're a member of an association or whatever it is, then or you get the emails and then you just go. Like I kind of didn't think about it. I just sort of went, and then the things that I liked, I would do more of, and then the stuff that I was like, yeah, this is like good experience, but like it's not my joy. I just wouldn't do again. But you don't know until you try, and when even growing up, so I played sports growing up, but it wasn't like one specific sport that I, really honed in on. So I kind of did a little bit of everything. And wanted to do the same. Tennis too. Tennis too. It was nice, like, yeah, like athletes care, because I worked with athletes care for quite some time and still am, obviously, in this mentorship role. But they always have opportunities. They're always emailing out for their clinicians if anyone's open to or wanting to go to an event and that kind of thing. Lots of opportunities through that. So that I think helped open the doors a lot as well. Um,
Yeah, that's nice. It's
hmm,
good your association does that and your work does that because who
mhm.
you wouldn't know about some of these events, right? Like unless you Googled them or whatever. You would
Yeah.
have no idea that these are happening. So that's great your association does that. For people who are looking
Mhm.
for physios, is there a certain website where they can go and search like where physios are in their area or anything like that?
So, well, all physios in Ontario are registered with the College of Physiotherapists of Ontario. So, collegept.org is the um, uh, website that you can look up physios. So that's like for any physios registered. But yeah, like I think probably a Google search in that sense, you'll get the clinics that are closest to you. Um, Look for reviews, look for referrals. I mean, I think I've always just, for me, for any other clinicians, I've just like asked other people like who their experience was, like who they've gone to and the success, like their successes and stuff. Or if like, I guess it's sort of different. Like I'm lucky in that I can, if I wanted to see a chiro or a massage, I have people in my roster or my team that I can address. But like for the patient, if you've got one like professional that you do go to now, ask them who they refer, right? Who's part of their team that I can also see to help maximize my rehab or maximize my healing time or whatever it is, or get back to whatever I need to do. um, like as the patient, develop your team. Like it's really important that you have your team. If you rely on just one person, um, there are probably, like we said, every condition is multimodal, multifactorial. Like only one thing is really going to be addressed with that one person. So find your team, ask that one person who's their team. Can I see any of them too? Um, or if they've got a friend that had really good success with somebody, go test them out in that sense too. Um, you do have to trial and error. Some of the best clinicians out there might not jive with you as a patient, and that's okay. You just find somebody else, right?
Yep. And that's exactly it. And to kind of round everything together, having that health history, that is essential, that you write everything down that you possibly can for that health history, because when physio or whatever healthcare professional is assessing you, then they have everything that they need to know about you for that first assessment moving forward to build that treatment plan for you. And then, when you build that rapport and that respect with that healthcare professional, then you can really go into different branches of what they think would be the most effective for you. So I think that's perfect. The team, the assessment, the health history, it's physio can cover so many different conditions. And I think that's also important to mention. And, and a lot of healthcare professionals have, other credentials as well. So ask them about them, get to know your therapist, because it's vital for your future, right?
Yeah.
And Joelle, thank you so much for being on this podcast. You are so awesome and so intelligent. And, I hope someone takes a lot from this conversation, because there are truly so many benefits of physiotherapy. And, you can start today, tomorrow, and book an appointment and further your well being and education on how to better your health.
Thank you so much for having me. This is great. Thank you so much.
Until next time, guys, thank you for tuning in. This is your host, Lindsay Geiger, and I hope you have a wicked day.